Bismillahirrahmanirrahim. Assalamu alaikum. A 25-year-old man come to the emergency department due to several episodes of hemoptysis over the past 2 hours. The patient has no chronic medical condition and takes no medication. He has never smoked cigarettes. Vital signs are normal. BMI 27 kg. Lung examination is normal. CT scan of the chest with contrast revealed a 3.2 centimeter widely enhancing homogeneous mass as seen in this exhibit with an endobronchial component at the left hilum. What is the most likely diagnosis in this patient? So, as I highlighted here on the blue, this is a mass which shows that there is an endobronchial component at the left hilum based on the hemoptysis, and the patient never smoked cigarette, and the CT scan shown here. What is the diagnosis of this question? So this is a 25-year-old man. He come to the emergency department due to several episodes of hemoptysis. He has never smoked cigarettes. CT scan of the chest with a contrast revealed a 3.2 centimeter, a widely enhancing homogeneous mass with an endobronchial component at the left hilum. Based on these here, the diagnosis of this question is bronchial carcinoid tumor, and here the correct option is choice B. So this young patient hemoptysis and radiographic finding, for example, mass size more than 3 centimeters, significant contrast enhancement are concerning for malignancy. Although common form of lung cancer, for example, squamous cell carcinoma, adenocarcinoma, do not typically occur in young non-smoker. These individuals occasionally develop lung cancer due to bronchial carcinoid tumors. They typically arise in the proximal airway and cause airway obstruction, for example, dyspnea, wheezing, post-obstructive pneumonia, or hemoptysis. So this is the endobronchial carcinoid tumor, which show as I highlighted here on the yellow, that there is a mass which show that the mass is more than 3 centimeter, and it gains significant contrast. So here is the aorta, and together with the mass there is a segmental pulmonary artery, and below with the mass here which show that bronchiectasis with impacted secretion. So this is the CT scan of the endobronchial carcinoid. Come to the incorrect one: squamous cell lung cancer and small cell lung cancer. So both squamous cell lung cancer and small cell lung cancer are typically occur in patients with heavy smoking and lifelong patient having history of smoking. So small cell and squamous cell lung cancer are also present as contrast enhancing primary masses involving the central airway, frequently causing hemoptysis due to endobronchial invasion. However, they almost always occur in active or heavy former smokers. Choice D, tuberculosis. So pulmonary tuberculosis can cause hemoptysis. Active tuberculosis infection can vary, occasionally present with a solid contrast enhancing mass known as tuberculoma. Patients have risk factors, for example, immunodeficiency, contact exposure, other constitutional symptoms, for example, malaise, fever, night sweat, weight loss. These are weight loss and cough and cavitary pulmonary infiltrate in the upper lobe of the patient are present.